I got to work in the slums. I walked the streets for hours, the neighborhoods flooding my senses. Pops of green, red, and orange from the fruit and vegetable stands. The smell of fresh paratha and samosas frying. The sound of laughter and conversations in Bengali. I'd said I'd wanted to go out in the field, interact with people, do things myself, firsthand. My professor said I'd get that. It would be challenging, and I could make a difference. That's what I wanted. I tried not to have expectations about Bangladesh, but I did get excited about going into the community, talking with people, learning about their lives, collecting data, improving access to health services, giving people a voice, helping. The International Center for Diarrheal Disease Research would give me this opportunity. In the slums, I wanted to ask a million questions. Are you able to see a doctor when you're sick? Do you worry about your health, your husband's, your children's? But I couldn't speak without a translator. There were never enough translators. We caused scenes. I felt like my presence distracted from the work instead of adding to it, not to mention the research process itself. Collect the data, scrub the data, analyze the data, make edits, find people to listen, to care. It's all necessary, important, helpful. It would make a difference. Eventually. But I wanted to make a difference now. It was during one of these visits that I met Maya, 8 years old, tall for her age, wearing a white salwar kameez with red and pink flowers. She grabbed my hand and led me around her neighborhood, excited, proud. Her smile was the first time I felt welcome, seen. And I wondered why it was so important to me to feel this way, to matter. That's not why I was there. Maya was my constant shadow as I collected data for an eventual solution. I went back to the US feeling useless, ineffective. I did things myself, firsthand, but I didn't feel like I made a difference. The data I helped collect will be useful in improving health services in Bangladesh, in communities like Maya's. But it felt so far off, a distant result rather than an immediate one. Then I think of Maya. There's resilience and strength in every person. The things we do for each other, even the smallest interventions, can and do make a difference. Sometimes it just takes time and patience to see it.